everyone. So today we will examine the vital role of occupational safety and health standards in risk management in creating a safe and productive salon environment. Occupational safety and health standards are standards that provide a framework for recognizing and preventing workplace illnesses and injuries. They emphasize proactive hazard identification and risk mitigation. And risk management is a structured process for minimizing risk. It involves identifying hazards, assessing the level of risk, and implementing control measures. To effectively manage risk, salons must follow specific procedures for hazard identification, like workplace survey, hazard identification, PPE requirements, hazard communication, proper PPE use, and attention to working conditions. The workplace survey, which is a thorough survey, is the first step to identifying potential hazards. And the hazard identification involves pinpointing specific hazards present in the workplace. PPE requirements. The employees must understand and use appropriate personal protective equipment or PPE. And in hazard communication, the employees need to be informed about the hazards present and how to avoid accidents. In proper PPE use, it is training on the correct use of PPE essentials. Attention to working condition. Special attention must be paid to conditions that can relate to creating a hazard. So as we all know, certain working conditions can increase the risk of accidents or illnesses, which these include infectious waste handling, chemical exposure, harmful dust, electrical connections, and wet flooring.
This image highlights the importance of proactive safety measures. Notice the safety equipment pictured. A wet floor sign and spill kit. These are vital for preventing accidents. The lesson objectives emphasize understanding protective gear, identifying hazards, explaining workplace risks, and implementing preventive actions. Now, let's examine the different types of hazards. This image details 5 key categories: physical hazards, biological hazards, chemical hazards, mechanical hazards, and ergonomic hazards. Physical hazards. These relate to the physical environment, including things like slips, trips, falls, faulty wiring, and poor lighting. Biological hazards. These involve living organisms like bacteria and viruses. Proper sanitation and hygiene are crucial to mitigate this risk. Chemical hazards. Salons use many chemicals. Understanding safety data sheets, or SDS, and using appropriate protective gear is vital. Mechanical hazards. These involve machinery malfunctions. Regular maintenance is essential to prevent accidents. Ergonomic hazards. These relate to repetitive movements and poor postures, leading to musculoskeletal disorders.
Creating a safe and healthy salon environment is paramount for both staff and clients. This video will cover the essential safety guidelines and chemical risk management, focusing on best practices. These guidelines outline key safety procedures for a clean and safe salon environment. Now let's review the essential points. The image highlights the importance of visible signage. Clear, easily readable safety instructions are crucial. Waste management. Proper disposal of waste materials, including products and garbage, prevent contamination and hazards. Product labeling. Accurate and clear labeling of all products is essential for safe handling and usage. Flammable material storage. Flammable materials require safe storage away from heat sources. Hazardous material handling. Safe storage and handling of hazardous materials are critical to prevent accidents and injuries. Smoke detectors and ventilation. Functional smoke detectors and adequate ventilation to minimize risks. Hygiene. Hand washing is a fundamental aspect of maintaining a hygienic salon environment. Comprehensive training. Regular safety training ensures that all staff members are aware of and comply with safety protocols. Now let's focus on chemical risk assessment. Using acetone as an example. Understanding the risks associated with chemicals and how to handle them safely is crucial. Let's address the key question regarding acetone safety. Risks of acetone exposure. Acetone can cause skin irritation, dryness, and respiratory problems. Eye contact can cause severe damage. Always refer to the Material Safety Data Sheet, or MSDS, for detailed information. Acetone interactions. Mixing acetone with other chemicals can lead to unpredictable and potentially dangerous reactions. Never mix chemicals without consulting the respective MSDS. First aid for eye contact. Immediate action is crucial. Flush the affected eye with copious amount of cool, clean water for at least 15 minutes. Seek immediate medical attention. The Philippine Clear Air Act of 1999 underscores the importance of reducing air pollution. While not directly related to acetone, it highlights the broader responsibility to minimize the releases of harmful substances into the environment. Proper ventilation and safe disposal are essential for compliance.
Workplace ventilation. Nail technicians are frequently exposed to various vapors and dust particles from nail products, which can be harmful if inhaled. The key is to work in a well-ventilated area. Use sealed containers to minimize vapor release. Dampen dust to reduce airborne particles. Avoid pressurized sprays that create fine mists. Regularly empty waste bins to control dust accumulation. Wear dust mask for added protection. Protecting your skin. Constant exposure to chemicals in client skin can lead to skin disorders. There are two main types of dermatitis: primary irritant dermatitis, allergic dermatitis. A toxic reaction caused by direct contact with irritants. This can be mitigated by wearing gloves and moisturizing the skin. This is primary irritant dermatitis, a reaction to sensitizers developing from mild to severe conditions. Avoid prolonged contact with potential allergens. This is allergic dermatitis. And now, for this part, address procedures for managing exposure to blood and the effects of chemicals on the respiratory system. Managing exposure to blood. Immediate and proper response is crucial in case of accidental exposure to blood or other bodily fluids. The following details is a step-by-step procedure. Number 1. Let wound bleed briefly. Number 2. Wash the cut with soap and water. Number 3. Rinse eyes if splashed. Number 4. Change soiled clothing. Number 5. Report the incident to a supervisor. Number 6. Seek medical advice. Number 7. Follow the indicated procedures: gloves, dressing, pressure, disposal of sharps, and cleaning. Always remember, prioritizing safety is essential for a successful and healthy nail salon. By following these guidelines and staying informed about potential hazards, you can create a safe and productive environment for yourself and your clients.
Preventing occupational overuse syndrome, or known as OOS. OOS is caused by repetitive movements affecting tendons, nerves, muscles, and soft tissues. Nail technicians are particularly vulnerable. Symptoms may include intolerable pain, stiffness, tingling, and needing to massage your hands. To prevent OOS, you have to maintain good posture. Sit in a natural, unstrained position. Avoid hunching over clients' nails. Change positions often. Regularly adjust your posture to avoid prolonged strain on any one area. Take regular breaks. Stretch and relax your muscles to prevent fatigue and strain. Ergonomics and safe lifting procedure. Ergonomics is about creating a workspace designed for comfort and efficiency. Let's look at workstation setup and safe lifting. Workstation setup. Your desk should be at elbow height when sitting. With your feet flat on the floor, your chair should be adjustable for height and tilt, and use lumbar support if needed. The work surface should be high enough to prevent lug bumping. Safe lifting. Before lifting, assess the load. Can you lessen it? Is it easy to lift? Can you get help? Follow safe lifting procedures. Lighting and hygiene. Proper lighting and hygiene are essential. Lighting. Use blinds or curtains to reduce glare. Utilize natural light whenever possible. Ensure sufficient light to work without straining your eyes. White lights offer a more natural light without heat. Hygiene. Maintaining a clean and sanitized work area is crucial for preventing the spread of disease.
Now, sanitation units. Proper sanitation is essential to prevent the spread of infection. Several methods are available. High temperature sanitizers heat to 250 degrees Celsius, effective for metal implements. Wet sanitizers use disinfectant solutions. Change the solution regularly. Ultrasonic cleaners are required, manual cleaning beforehand. Now, chemical sanitation. Chemical sanitation involves cleaning, removing dirt, disinfection, killing microorganisms, and alcohol use. 60 to 70% isopropyl or 80% ethyl alcohol. Always follow manufacturer instructions and safety precautions when handling chemicals. So, fire prevention measures and emergency procedures. Fire prevention is vital. Ensure a functional fire alarm system, sprinkler system, and fire extinguishers. In case of fire, remember the pass method. So the pass method stands for P for pole, A for aim, S for squeeze, and S for sweep. For extinguisher use and RACE method. RACE method stands for R, rescue, A, alarm, C, confine, and E, evacuate. For emergency response. Regular fire drills are essential.
And also, let's not forget to follow the 5 Rs: reduce, reuse, recycle, recover, and dispose. These are proper disposal methods help protect the environment. By diligently following these safety and hygiene procedures, you create a safe and healthy environment for both yourself and your clients. Remember, safety and hygiene are everyone's responsibility.